yesterday. They were transported safely. All of them arrived at their destination in good health. A team from Eastern Regional Health Authority is actually looking after them, providing the necessary food and supplies to them. They are actually visiting them twice a day to make sure they do health checks, including fever checks, temperature checks. If any of them show any signs and symptoms, they will be tested immediately as well. So in terms of my epidemiological update, I wanted to add that bit for this morning, and we'll take questions later on.
Sorry. Okay, sorry about that. Good afternoon, everyone. I am Dr. Hazel Othello, and I'm currently the Director of the Mental Health Unit in the Ministry of Health. My role today is simple. It's just to ensure that we are taking care of our mental health during this period. Change is always difficult, and we've all gone through some changes in the last few weeks. We've been exposed to information that we've never had to receive that kind of information before, and we've been getting all sorts of information, some of it true, some of it not true, some of it helpful, some of it not helpful, but it's been affecting, or if we're not careful, it can affect us. And therefore, we have to be mindful of that, and we have to take care of ourselves, particularly for persons who have been isolated or are in quarantine situations. Their health is of paramount importance at this time. They've gone through changes that are very different from anything they've ever experienced before. They may find themselves feeling anxious. They may find themselves feeling sad or confused or irritable. And those are, to some extent, very natural reactions. It's no cause for worry. It's no cause for panic. What is important is for people to support each other, encourage each other. Even those of us who are free to come and go as we like may find that at times something you read or something that you hear may evoke a certain reaction. It is important that we try our best to stay calm, particularly with information from social media and so on. Please verify what you're reading. In fact, sometimes it's helpful to limit yourself. Too much of it just isn't helpful. I have stopped reading posts from certain social media groups that I'm in because after a while it was just information overload. And I think all of us sometimes need to do that. Sometimes it's just too much. It might be accurate, but it's just too much. So we have to take care of ourselves. We have to take care of our families. We have to take care of our children. Children respond to what they're seeing the adults around them doing. So if you are panicky, if you are anxious, children around you will pick that up. So it's important, particularly now that school is unfortunately out, we were not attending school anymore. It's very important for parents who are supervising children at home to ensure that those children are kept in a calm state by explaining things to them in simple terms, not saying things that would cause them to panic or to be anxious, not letting them see anxiety in your reaction, and above all, try to maintain some schedules that keep them, keep things in a pattern that they've been somewhat accustomed to. So in other words, let them do things they enjoy doing, but let them do some schoolwork as well, let them have their recreation, let them eat on time, so that there is a rhythm, so there's a pattern. In other words, they know what is coming next. They're not wondering what's in front of them. For people who have pre-existing mental health conditions, it is very important that you take particular care of yourself. In other words, you may have been on some kind of medication for your disorder, whatever it is. Please continue to take your medication. Please continue to maintain contact with your mental health care provider. Now is not the time to stop taking your medication. If, for instance, you're on a monthly injection, that will continue to be provided to you, so you don't have to miss it. Your symptoms do not have to start to recur during this time if you take care of yourself. The other important group of people we need to pay attention to are people who are at risk for substance use disorders, particularly, for instance, if you're a recovering alcoholic. Now is not the time to try to cope with the stress by taking a drink. That is just not an option at this time. I've seen some ads, and not ads really, some interviews on TV with people sitting outside bars talking about coping by, just a few drinks and you'll be fine. That is not the best coping strategy. Okay, that is just not the best coping strategy. And it's particularly dangerous for recovering alcoholics who need to maintain their sobriety, and recovering persons who have been users of other substances. Please continue to maintain your sobriety during this difficult period. Thank you.
Thank you very much to our Minister of Health and our medical experts. Ladies and gentlemen, members of the media, wider viewing and listening public of Trinidad and Tobago, it seems as though we cannot emphasize enough some of the messaging that we've been sending, at least over the past week and a bit longer. I'd like to start off this afternoon by reminding us all about personal social responsibility, because all of the literature internationally, globally, because this pandemic is global, immediately suggests the simple social, personal, responsible actions: washing your hands, not touching your face. We've repeated it. You hear it being repeated time and time. And I sat here and I was watching out and seeing some members of the media continuously touching their face. These are habits that we need to find a way to break, and continue washing your hands. That then goes to the point of social distancing. The government yesterday made the strong suggestion via our Prime Minister after a cabinet discussion that persons not have social gatherings now of more than 10 people. But of course, common sense applies. We were careful to say social gatherings, which would include religious celebrations, but also religious gatherings for the purpose of worship and these types of things. It does not mean workplaces. So in your workplaces, of course, you will continue to have the social distancing as we're exhibiting in here. Keep your distance, continue to have the personal hygiene, and each workplace would work it out in terms of rotation of staff and these types of things. I've also just been asked about groceries and these types of things. I went to the grocery last night, partly to get stuff myself, but also to take a look and see how the public was reacting. And I was pleased to see people exercising social distancing. These are some of the places where obviously you can't have closure. Obviously a large grocery will not be limited to 10 people alone on the inside, but persons there will be limits. There will be, when you're lining up, of course, keep your social distances, etc. The authorities in certain places, having listened to the government's advice, have taken certain decisions, and I congratulate them on that. I am only naming a few here today, but they are sending examples, and I am certain this is happening throughout Trinidad and Tobago by people who are being responsible. We need to contain the spread of the virus. The virus is all about contact, so the more that we can avoid contact, the better in these social gatherings. So you all would know by now that the regional corporation, where Cora falls under, this morning took the decision to block off the access to the road. That is a very responsible move. It does not mean that people should park their car, however far away now, and trek all the way in. We are trying to keep people contained and to avoid these social gatherings for the good of the country. Yesterday, you would have heard our Prime Minister talk about selfish actions and decisions of a few and how that affects everyone. Just before coming in here, I saw an article that in France, because they didn't take the decisions that we have taken early enough, now everyone is confined to their house. You have to fill out a form to be able to leave your premises because people did not heed the early warnings. Unfortunately, again, Trinidad and Tobago made some very early decisions, for example, the shutting down of schools. It's only today in the United Kingdom you're seeing them shut down schools. In the USA, certain states still taking those decisions. Those have consequences. The countries that have managed this successfully to start with, it is because people exercise the social responsibility that we're asking you to. This then leads to the issue of travel. I said yesterday, and I'm going to repeat again today, because I'm still being, requests are still being made to me. The government has taken the decision and instructed me as the Minister of National Security not to allow non-nationals into Trinidad and Tobago for a 14-day period in the first instance, starting from midnight on Tuesday gone. That is not going to be waived lightly. So unfortunately, there may be families who have children that are non-nationals. They may have spouses who are non-nationals. We are trying to prevent the spread of the virus, not only here in Trinidad, but globally. We have said for well over a week now that we are only suggesting travel if it is emergency travel or it is absolutely necessary. And that applies across the board. So we are not going to be waiving very easily the restriction on non-nationals entering Trinidad and Tobago. With respect to persons traveling who may be nationals but no longer carry a Trinidad and Tobago passport, again, it is up to the international airlines as how they treat with you when you're trying to board an aircraft in another jurisdiction. It is very difficult for international airlines to determine via what appears to be a birth certificate or a Trinidad ID card that you are in fact a Trinidad national. And I will say this now, the mere fact that you are the holder of a Trinidad and Tobago birth certificate and you have another citizenship does not mean that you continued to keep your Trinidad nationality, because some countries required people to revoke their Trinidad and Tobago nationality to take up the nationality of another country. So these are the things that cannot be determined by airlines at a counter, and certainly we cannot determine it here via persons making those requests to us, as is happening. Every country in the world is asking that people just stay put, because that in itself avoids the potential spread of viruses. We have said, and it is worth repeating, international airports right now are not a place that people would want to be, because there is the potential, the high risk potential for the virus being present there. Also, if people are sick, obviously you should not get onto airplanes and travel, because then you're exposing it not only to the persons on the airplane, but every single person you come into contact along the way. These are the decisions that countries in the world, including Trinidad, are taking in restricting travel. That comes down to social responsibility as well. The Chaguaramas Development Authority has just notified me that they have taken a decision and they've closed public access to their beaches. I think that is a good move in the right direction. I told you about Cora a short while ago. There are other municipal corporations that will take similar determinations. With respect to the bars and the restaurants, and it continues to be, and we will be going tomorrow with very limited legislation to the Parliament. One of the things we looked at overnight, and the Attorney General advised the Cabinet today, and we accepted, is under the old Public Health Ordinance. It allows the Minister of Health to make certain regulations, which have been done. The Cabinet decision was taken today to instruct the Minister of Health to do it. So there are going to be Public Health Ordinance regulations, stopping the opening of bars, allowing restaurants just to serve food but no in-house dining, dealing with casinos and other members clubs, because we don't want people socially gathering in the next couple of weeks. This is a critical period we continue to be in. The goodly doctor who came to speak to us about the psychological effects touched on a very important point that we want to emphasize once again from the government perspective. We are still seeing people being very socially irresponsible. And unfortunately, there's a political element to it as well, with trying to create a sense of panic, trying to push out there via social media false information. That is something that the government does not condone. We, in fact, condemn it. And the sensible population of Trinidad and Tobago do not appreciate it either. The sensible population of Trinidad and Tobago, which is a vast majority, are criticizing the proponents of this, who for some reason, only known to themselves, continues to do it. In fact, as we were coming into the post-cabinet press conference, certain persons who are now becoming notorious for this type of messaging continue to push it out, questioning certain decisions. The government has been fully transparent. In fact, our public servants, I'd like to applaud them, in particular those at the Ministry of Health, the frontline workers, the CMO, all of our other experts who've come to address us, for doing a remarkable job and really doing service for the country, all other service providers as well. So We condemn the continuation of this type of activity and behavior, but I ask the population, just take a look at it. See the quarters that it is coming from, and you are smart people. You for yourselves have already determined the negativity that they're trying to spread and reject it. The only sources of information that are the official sources of information for any government messaging with respect to COVID-19 continue to be the Ministry of Communication and the Ministry of Health working in tandem. Those are the only two sources of information for anything to do with the COVID-19 at this stage. National security continues to do its job. We continue to work along as support for the Ministry of Health. In fact, on daily conversations with the Minister of Health and his team, the CMO, we continue to be looking throughout Trinidad and Tobago for potential places that can be used for isolation, which leads to the point of self-isolation and self-quarantine. All persons returning to Trinidad and Tobago, which at this stage should only be nationals or those who are exempted, we are pleading with you to self-quarantine yourselves without us having to use the full force of the law. As I said at the outset, when you're not socially responsible, you put everyone else that you come into contact with and anyone else they come into contact with at risk. Everybody who returns to Trinidad and Tobago, please self-quarantine for that 14-day period. And that doesn't mean, for example, if your wife returns, that you can go interact with your wife, say, well, I've left her home, and then you go out now into public, because that defeats the whole purpose. So if you're taking your family members in your home, it is either, unfortunately, you keep them isolated, or if there's interaction, it means that the family now enters into a quarantine period. The question was asked about the Balandra facility. It was an excellent decision taken by the Ministry of Health along with National Security on the advice of the CMO and his experts, rather than move people immediately to our medical facilities at Cora and at Cuba. The responsible thing was to take persons off-site in a secluded area away from the general population. People being in a compound of that size cannot infect persons on the outside. It simply doesn't work that way. But it allowed us to self-contain them. It allowed us to put them into quarantine under the watchful eyes of our health personnel and our health experts. And then, if necessary, we continue to, not if necessary, we continue to have the availability of our two major facilities, which are at Cora and at Cuba, in case there's a need to put more persons in there from outside of those 68 people. We continue as well to take decisions out of the Ministry of Health. There's an ongoing discussion at looking at other medical facilities that we are looking at now currently bringing back on for the specific purpose of dealing with COVID-19. So the government is continuously looking at increasing the availability of our asset base for quarantining purposes, for medical treatment purposes. This thing is very, very dynamic, but there are also different tiers of care that the government would need to take depending on the symptoms, the stage, and what needs to be achieved. And we continue to do that in order to protect the citizens of Trinidad and Tobago. From the national security perspective, that is it. We continue to work wherever Ministry of Health has requested our assistance. We are giving them our full assistance. Thank you.
I just want to go back briefly to the timing of releases when we get COVID-19 positive tests, because this is a serious matter. Let me explain to the media the mechanism so you will understand the hurt you cause when you question this. When CARFA runs a test, the first person they call when they have a positive test is the chief medical officer, who's a public officer. They don't call me. Whether they call him 8 o'clock in the morning, 10 o'clock in the night, 2 o'clock in the morning, he wakes up. He wakes up. He then calls corporate communications at that time, who is another public officer, to write the press release. Yes, we have a format. We just put in the data. For that press release to be approved, we have to wake up the permanent secretary, who is a public officer, and then they wake up the Minister of Health. When that process is questioned, it ruins the reputation of the Chief Medical Officer and all public officers who are working in your best interests. I plead with everyone, I have asked everyone, let's be responsible. Okay? Thank you very much.
Thank you very much. Ladies and gentlemen, the floor is open for questions.
Who can answer? Any update on the situation with the Cabo Star vessel?
Chief Medical Officer.
So basically, I would have received a call from my Port Health officer just after 7 this morning indicating that there was an ill person aboard the Cabo Star, which came from Tobago to Trinidad. The person was taken by GMRTT to Port of Spain General Hospital. It's a local, was assessed to have no history of travel recently. It seemed like it was being the diagnosis given upon arrival was something called lower respiratory tract infection. Was not ruled out COVID at the time. There was no suspicion. However, out of an abundance of caution, we held the vessel, and you may have noted that persons weren't allowed to disembark until I was able to ascertain that information. So once I was confident that we were dealing with possibly a normal flu-like illness or cold, we would have still taken the contacts of all the persons on vessel, which was crew. There was a small number of passengers because it is a cargo vessel. So we actually have the contacts in terms of names, addresses, phone numbers, and the county medical officer will still be in contact with them. Just in case, on the off chance they develop symptoms, we'll be able to advise them appropriately. But the crew is allowed, is now on into a 2-week shift, which I believe started on Sunday. So they will remain on. The only persons that would have come on would have been the few passengers, which is actually persons that would have driven the trucks on board, and they will be on and off. So we will follow them as well, just to make sure. But the medical experts at Port of Spain have said to me they think it is a normal lower respiratory tract infection.
And so those people will be in self-quarantine, right? The people on the passenger.
There's based on, they don't think it's suspected COVID of any sort, so no.
Question to the Minister. Earlier this week you had mentioned 2 U.S. citizens who had been put in quarantine. Any update on that from either you or the Health Minister?
Those 2 citizens, I'm looking towards the CMO. Those, you want to... These were the 2 persons that we had picked up in Piarco. I believe it was, when did we have the press conference? On Sunday. And one of them had presented ill whilst in Piarco, and we took them into... They haven't presented, obviously haven't presented any signs or any effects, etc.
Sure, and we have not returned a positive result for any of them.
Mr. Diyal Singh, what does it cost to the state to house, feed, provide health care to these 16 individuals in Balandra?
Those costs are being tabulated now, but they are being paid out of the recurrent expenditure budget of the ERHA. I am taking a note to Cabinet next week to come up with an approximate budget for what we will need, especially for COVID, as demanded by the Cabinet note of 2 weeks ago.
I'd just like to add at this stage, because that's a question persons always like to go towards, and understandably so. At the end of the day, we need to protect the population of Trinidad and Tobago, especially with the very, very contagious effects via contact of this virus that is pandemic throughout the globe. I can assure you, because that's also a constant conversation that we're having, that we are doing that by protecting the taxpayers and ensuring that whatever the arrangements are, they are the least costly to the taxpayers. So, for example, the reason we chose Napa over other facilities that are available, private facilities, is because Napa is owned by the state. And I can give you all an example. Rather than go out and procure the bed sheets and stuff privately, what we did is we utilized the healthcare system, we utilized what the Army has available, etc. So that is how we're operating. So there is, in my humble opinion, we need to focus on the preventatives of how we deal with the spreading of this virus. But I assure the population of Trinidad and Tobago, it is being constantly done by the Ministry of Health with discussions to protect the taxpayers.
And let me just say, Our response to COVID is now being used as a model around the world. We have done so well in managing this, in setting up a parallel healthcare system, in absorbing 68 people yesterday seamlessly, and we didn't stop anything in our regular healthcare system. And I want to thank again, because I don't think they get enough thanks, the Chief Medical Officer, who is up literally 24 hours a day, and his technocrats, CARFA, up 24 hours a day, healthcare workers who are the forefront of this, responding to the call for national duty. That is true patriotism. True patriotism. It shows the best of Trinidad and Tobago. And I really want to salute the Chief Medical Officer, his technical staff, doctors, nurses, wardsmates. Thank you.
There's a question for the...
Just to follow up on what you're saying, Minister, I just want to make it clear, and I know I can't speak for the entire media, but I don't think anybody was casting any aspersions towards the hardworking public servants. What the media was trying to make clear was, listen, we started off by getting all the information with the first patient, and all of a sudden, it started to get later and later with minimum information. What the media has been asking for is a little more. What era this person is from, what some of the history, just because people ask us and we have to tell them.
Yeah. And I just want to add to that you had used the term that we were annoyed.
Yeah, nobody was annoyed.
And we weren't annoyed at all. We just said, it just so happened that the information, as he said, was coming late. So there was no annoyance on our part, and we didn't suggest or feel that the remedy for that was to give us now 2 times that might not be in any way in sync with the gathering of the information on the part of the authorities.
Yeah, so with the first case, I mean, of course, the country would have awaited the first case, I suppose. I think we would have given out too much, to be honest. That's right. When we are walking a thin line when we're dealing with patient confidentiality, we're dealing with people that are ill. Actually, the only person that's supposed to get the result of an ill patient is the patient themselves or their direct relatives. So actually to give out anything beyond that will be an identifier of a patient should not be done. And I think going forward, our information is sufficient to say the number of cases that we have thus far as positive without an identifier. And we are living in a small society where people talk and they know who their neighbors are. And for the benefit of the patients and their families, we want to ensure their safety as well as the safety of the population. We want to keep the information to a minimum.
I'd like to add for that from the government perspective. First of all, the point is taken. There's no about the media that Ria raised, etc. When you look at this thing internationally and globally, we are keeping with best practice. So in the United States, for example, there's a sudden spike in the number of cases a day, including a number of deaths. You never get the information, even of if it's a male, if it's a female, how old they are, etc. That is keeping in with that practice. As the CMO rightly said, because we were all in the room when the information came through, the first case, it was the first case. People were waiting, but immediately, even with that minimum amount of information that was put out, travel and this type of thing, within a matter of minutes, because we're a small society, we were then being bombarded by, is it this person works here, this is who the person is, and this type of thing. That is not what you want in a situation like this. So yesterday I heard it being suggested that in other countries they're giving much more data, etc. We have to be responsible. We are being responsible in how much information is being provided. The decision is not going to change. We will continue to provide what we can, respecting the patient confidentiality. There are a lot of other balancing exercises that need to be taken into play.
Let me just say, I was approached by many patient advocacy groups after that first one, and I was roundly condemned for sending out so much information. And as the Chief Medical Officer said, maybe we erred in the first one. And we have to respect patient confidentiality. As the Prime Minister said yesterday, would you like, if that was you, would you like that your personal information to be out there? The government has nothing to hide, and we will give out as much information as we deem relevant. As the Chief Medical Officer said, we may have erred in the first case.
Questions? Any more questions?
Are we still going to get the releases only at 10 o'clock and 4 o'clock?
Yes. Only at 10.
Chief Medical Officer, that is your decision.
So I think 2 times a day for releases as to how many positives and negatives we have is more than enough. And as the numbers will continue to rise slowly, I think twice a day is enough to know how many negatives we have and how many positives we have. And I think that's the best way to communicate at this point.
Sean?
Just in terms of, sorry, can I just finish on this?
Sure.
In terms of testing, we listened to the WHO saying test. Up to last night, the executive director of Cabo was saying, listen, maybe we should be doing more testing. Is this something you are now revisiting as to the criteria you're using to test people, as opposed to not just travel history, but maybe they came into contact with somebody while they were in Trinidad?
Yeah, so there's 2 different things you're talking about. One, you're talking about the definition of what we consider a suspect case. So a suspect case is anybody would have had recent travel history and the clinical signs and symptoms suggestive, or anyone that would have had a relation that would have had someone close to them that would have had travel history and then had contact. So we're looking at exposure. It also includes anyone that would have had close contact with a positive case, anyone that would have had close contact with a suspected case as deemed by a healthcare professional. All those 4 meet the criteria in terms of what a possible case is, a probable case. So what we do, we have that grouping there. There's a guideline that is sent out by CARFA. So CARFA is the regional body that determines who is to be tested. The guideline that is sent to us at the Ministry of Health and the other ministries in the Caribbean indicate that testing should be done from day 0 of the onset of symptoms to day 5. If we go beyond day 5, day 6, 7, and 8, they will possibly not take the test or not do the test, even if we send it. And if it's less than 0, meaning you have no symptoms, the test will not be done. And that's what the guideline states to us. So unless CARFA changes their guideline, the second part of it is up to them in terms of the international best practice, and they are following best practice. So we continuously liaise with CARFA to look at their changing guidelines if and when it will change. But for now, we are abiding by their guidelines.
What does the WHO say? Is it is what WHO say consistent with what CARFA
I
is
think
doing?
PAHO and CARFA, PAHO is our region of WHO, and PAHO guides CARFA as well. So I think they're all in sync in terms of the types of persons to be tested.
Okay, just a question on the 2 new cases. Are these both imported cases? Or
yeah, we said so in the release.
Okay. The other thing is there any sort of ratio of suspected cases to what there may be out there? Like, is it, well, if you like, positive cases?
Well, the only ratio I have right now is how many people we tested versus how many you have positive. And we're looking at 150 tested so far, and 9 positive is 15 to 1, that sort of ratio in terms of turnover. But those are patients with symptoms.
Dr. Parasram, now, while people are waiting on their test, they will obviously be in self-isolation,
Sure.
perhaps at Cora. Is there any sort of medication you'd like to recommend that they take while awaiting their results? I know there's been reports about not taking ibuprofen and
yeah, so there's recommendations indicating that NSAIDs, which is a broad category of drugs, including ibuprofen and others, that we have recommended in the past not to use for other diseases like dengue because of the risk of other complications. So we are seeing early recommendations not to use NSAIDs. The safest bet is to use a normal paracetamol sort of reliever for fever. That's the only thing you should be using at home at this point.
Can you walk us through the proper procedure, proper usage for gloves, masks? We see everybody walking around with them.
Yeah. So there was a full press conference from it, but in terms of the population, there are tiers of proper usage for healthcare workers, for the general population. At this point, the Ministry of Health does not generally recommend the use of masks by the general population. We continuously recommend the use of hand washing and what we have been saying all along, sanitizing your hands, coughing into your sleeve. If somebody is ill, though, we recommend the use of masks, only then at this point.
I was wondering, what are the protocols for, I've said this before, but just as a reminder if you
Sure.
have, for those healthcare workers who are dealing with the positive cases in terms of ensuring their protection and so on?
So yeah, so there are different tiers of healthcare workers we have to understand. So there are healthcare workers, for instance, that will be required to take samples from them, which will require the highest level of precaution, or do invasive procedures, for example, intubation in an ICU setting. We will need a certain level of PPE for that group of people. There will be a primary care health worker that will be able to have some distance between themselves and the patient. So what we have been doing is having separate triage areas so that we can actually get the social distancing between the patient and the worker, so that actually 2 meters apart, they do a bit of history, a conversation, and they determine what they think the risk is. So based on which healthcare worker, we have different levels of PPE, and all the RHs have been trained. We have utilized the PAHO material and the PAHO trainers in certain instances to ensure that the groups of staff that need to be trained and prepped are done so. Also, the PPE, as Minister would have indicated yesterday, has been increasing in terms of supply in the country, and we are distributing as need be.
The ages, have you seen any sort of trend, or what are you seeing? So far we have 9. In terms of the ages, what trends are you seeing?
Yeah, so it is a little too early. When you have imported cases of any disease, it is sort of random in terms of the ages. When a disease becomes endemic to a country, then it becomes a little more relevant and widespread to actually do the epidemiological modeling to determine the patterns. But the patterns that we have been seeing and people have been talking about, the 3 at-risk categories are those with chronic diseases, diabetes, hypertension, cardiovascular disease in terms of mortality, elderly, and healthcare workers. Those are the 3 categories that we need to pay a close attention to in terms of the way we treat so far.
On Monday, you would have committed to getting some figures in terms of how many people you...
I can give you an average. We are doing, well, as you know, we're getting new cases every day, mostly. But for one patient, we have tracked thus far 66 primary, secondary, tertiary contacts. So that'll give you an average of how people move, levels of exposure, and that sort of thing. On Friday night, we would have someone going on to television to discuss that a little bit more.
And in terms of the quarantine, how many people would the state have put on the quarantine? I know you would have given a commitment to giving those figures as well?
Yes, so the figures are, as I said, is still ongoing. So it's based on the contact tracing. If you pick up somebody that we deem is at risk, we quarantine them, so it is an ongoing process. And it changes by the day. So, I mean, I just wanted to give you a guide with the first one that we have completed, which is 66, so you can get a rough idea based on the numbers that we have.
Quick question to the Minister. Yesterday, the Prime Minister would have said he read out a message from China, and I think it was 4,000 test kits they are sending to us. How do you intend to use those?
Well, those, okay, I don't use them. All testing goes to CAFA. The Ministry of Health will receive this as a gift from China. It will go to CAFA. It will be used in their machine is a type of test called PCR, polymerase chain reaction, and they will use it. And what we can start to do, as the CMO said, you will start to go like concentric circles. You have your first case, you start to test your primary contacts, you start to test your secondary contacts. So we can ramp up testing if required. I know the issue of random testing comes up, and you ask, why aren't we testing? So let me make 2 points again, and the CMO can back me up here. It makes little or no sense to test asymptomatic people. You will not have enough viral load in your system to get a true positive test. What you will get is a negative test, and it will be a false negative, meaning that person could have the virus, walk around thinking he is fine, and cause more damage. I will refer you to Dr. Sanjay Gupta, who was speaking on this same issue yesterday on CNN. And he says random testing makes absolutely no logic. It makes no sense. All you do is waste scarce resources. And we are in a pandemic. You must guard your resources very closely. So when you have tests that you must do, you have enough at your disposal. Random testing makes no scientific sense. WHO does not recommend it. And we are following all the science to protect our population.
When you say random, I want to be clear as to what you mean by random, because I think what I was referring to was people who have come into some kind of contact with someone who tested positive.
Explain.
Yeah, and I think we're basically going back.
Yeah, sure.
Yeah, we're basically going back to the same discussion we had before, which, of course, if somebody's in contact, the most important thing is that we isolate them, quarantine the group, so that there's no further exposure. We wait until symptoms come. If symptoms does appear, we do the testing. If nothing comes for 14 days, you can be more than certain that there hasn't been conversion to disease.
Minister Young, you said that police officers will be visiting bars tomorrow.
I said that police officers will be visited.
Visits will be made tomorrow, is that correct?
I didn't say that. I said what we will be doing is the Minister of Health is putting in place regulations under the Public Health Ordinance. I can tell you that police officers have already started from the first day that we pronounced on it. So yes, we have police officers, and what I've asked in the various communities is that they just make the rounds, just remind people. You would have seen yesterday the Commissioner of Police put out a media release talking about the law of loitering. At this stage, we don't want to go down the road of any heavy hand. As I keep trying to emphasize, it's all about everybody's personal and social responsibility. And let us emphasize the good. You have seen, I suspect, from what I'm seeing, over 90% of persons with these establishments, if not a higher percentage, actually heed the call of the government. But the police and the defense force will continue to do their job, will continue to go around to do what they can to make sure that people are listening to the government's messaging.
And for those who are not listening, not heeding the call,
let's hope there's none, right? But at the end of the day, they will use their persuasive power. So when I was speaking to the police divisional commanders on Monday, I said, look, just transmit down through the police service. You have uniforms. People respect the police or should respect our police officers when they go up and say, listen, you all are loitering. Please move along. Please go to your homes. Remember what the government has said. Let's hope that everybody abides. A worst case scenario, the police will do what they have to do as they do every day, even before this. The regulations that will come into place by the Minister of Health will actually now give further legal authority, others outside of the law of loitering, for us to literally close down bars, meaning all bars will be suspended, and we'll be seeing from that no bar can be open, and that is now going to be pronounced in law.
Look, let me just make a point here. The population really has to use a lot of good judgment. I don't think you want the government saying this is a list of activities. We are asking people, don't gather in more than 10. So people ask me, should I have a funeral? Should I have a wedding? We can't be that prescriptive. What we could ask people to do is, look, this is a global pandemic. We are asking you to apply your own good sense, your own common sense to protect yourself, protect your family, protect the elderly. Globally, you are seeing young people succumbing to the theory that they are invincible. And what they do, they take the virus home and infect their grandparents and their parents. If you are having a wedding, if you're having a funeral, try and cut it down as much as humanly possible. These are not normal times, and we all have to make some adjustments.
With respect to the test kits, the 4,000 test kits, are those to be used exclusively for Trinidad and Tobago nationals or citizens, or does it go into the general pool of CAFA members?
Good question. The test kits we are getting from China is a gift to the people of the Republic of China because they were very grateful that we sent them 13,600 masks, which we had gotten from the private sector. It shows that our relationships with China remain strong, and those tests are a gift to the government and people of the Republic of Trinidad and Tobago and will be used for Trinidad and Tobago. CAFA has over 3,000 tests, and they are getting more all the time to take care of their regional commitments.
Mr. Diaz, administrative question. Has the Ministry of Health been in discussions with insurance providers, for example? Because, I mean, I would expect increased numbers of claims for sick leave and all those sorts of and even NIS for, claims for sick leave and all that. And just also very quickly to Dr. Othello, have you seen an increase in inquiries about people regarding their mental health?
So I'll answer your first question. That is not the remit of the Ministry of Health. NIS and so on falls under the Ministry of Finance. But as we said yesterday, we are asking everyone across the board, banks, everyone, to be flexible.
Okay, most mental health disorders don't present symptoms immediately after the stress factor that causes the symptoms. So it would be rather remarkable if we saw a sudden rise in any kind of mental health disorder. What happens is that people's baseline level of anxiety begins to go up, or their baseline levels of frustration, tolerance, or irritability may start to rise. And that is the point at which we encourage that at the community level, we support each other enough so that things do not escalate to the level that where other levels of care are required. There will be some people who will require professional help at a level beyond the community level, and we expect that, and we're quite prepared to deal with that, but we need everybody to do their part before it gets to that level. Okay, you're not going to see a sudden increase in depression or a sudden increase in panic disorder or any other diagnosis like that within such a short period of time. If somebody experiences a particularly severe stressful event, then you may see post-traumatic stress disorders sometime afterwards, but it still is not immediate. Does that answer your question? Thank you.
Thank you very much. Just want to remind you that to check on the Facebook pages in social media concerning the Ministry of Health and the Ministry of Communications to get all information on COVID-19.
Thank you very much.
And thank you very much. You have been